Heartfelt gratitude from Bangladesh. It's an honor for me to represent my country in this platform. And it's also a great pleasure to present a topic in front of the learned audience. My topic is impact of diabetes mellitus on carotid artery stenosis in a patient undergoing CVG, a prospective single center study in Bangladesh. Myself, Dr. MD Abir Tazim Chowdhury, and this is Bangabandhu Sheikh Mujib Medical University, the place where the study was conducted, and it is the first and oldest medical university of the country. My institute where I completed my post-graduation degree. This is my current working place, that is Evercare Hospital, Dhaka, Bangladesh. So before proceeding to my topic, I would like to give a brief background. Atherosclerosis is an worsening disease process affecting arteries. When the process starts, no arterial system is immune from this disease. Among the several risk factors, diabetes is the most significant one. It increases the risk fourfold for developing carotid artery, coronary artery disease, carotid artery disease, and peripheral vascular disease. Carotid artery stenosis is a potential influencing factor for cerebral ischemic assault in patients with ischemic heart disease who have undergone a myocardial revascularization procedure. So cardiovascular disease and its global scenario. In real world scenario, approximately 30% annual mortality was resulted from this cardiovascular illness, and about 10% mortality was caused by cerebrovascular events. In Western countries, the observed proportion of carotid stenosis among the CVG surgery patient has gradually increased from 12.8% to 22% over last few decades. So what about diabetes mellitus and its global scenario? Diabetes mellitus remains a significant contributor to the global burden of disease. The International Diabetes Federation has estimated that 463 million adult lives with the diabetes worldwide in 2019. Among them, 88 million reside in Southeast Asia, and 79% were from lower middle income countries. So what about my beloved country, Bangladesh? Diabetes mellitus and Bangladesh, it's really alarming. The study showed that 8,400 million adults were suffering from this diabetes in 2019, and it is projected to be 15,000, that is double by 2045. So stroke and CVG. Stroke is a grave complication of CVG. Incidence is around 2% perioperative for perioperative stroke. With significant carotid artery stenosis, the risk is more than double. Stroke, when the perioperative strokes and other neurological events happen perioperatively, lead to higher mortality, prolonged hospitalization, and increased healthcare expenses. Routine carotid artery duplex ultrasonography scanning is the useful to stratify the carotid artery disease, and it is believed that appropriate management or intervention for high-risk group patients will reduce the neurological events perioperatively. So with this background, our study objective was set, and it was to estimate the frequency of carotid artery stenosis among the patient undergoing isolated CVG and the impact of diabetes mellitus on carotid artery disease. This study was approved by the concerned departmental academic and technical committee and followed the guidelines which was outlined by the Declaration of Helsinki. Our method was a prospective comparative cross-sectional study conducted at Department of Cardiac Surgery, BSMMU, from July 2018 to June 2019, which enrolled 100 isolated CVG cases. All the cases were divided into diabetic and non-diabetic group. This is our selection criteria. Patient of coronary artery disease underwent isolated off-pump CVG were selected, and then the study were include the patient who are willing to participate, those who are elective case and hemodynamically stable, and study exclude those patients who are not willing to participate, emergent case, hemodynamically unstable case, having history of stroke, and coexisting congenital and valvular heart disease. This slide is about our study design. We assessed the population for eligibility. Out of 145, finally we enroll 100 cases. The study excludes those who are not willing to participate and those who are not fulfill the inclusion criteria. Then the patients were evaluated and grouped between group into diabetic and non-diabetic. In diabetic group, we include 42 and non-diabetic 58. All the allocated patients, all the patients were allocated for carotid duplex scan. Then the data were collected, processed, and analyzed. Finally, results were made. This is the machine which was used by our vascular surgeon to assess the carotid artery of the patient. They follow the Society of Radiologists in ultrasound consensus conference criteria to classify their severity, and they calculate peak systolic velocity of the internal carotid artery and the ratio of the peak systolic velocity of internal carotid artery and common carotid artery, and categorize the carotid artery into following. These are the normal, according to the diameter stenosis, the normal. Those less than 50% are categorized into mild, 50 to 69 moderate, more than 70 or equal 70 is categorized as a severe carotid artery stenosis, whereas near total occlusion and total occlusion is also categorized by them. In current studies, the significant carotid artery stenosis were level when it is more than equal 50% stenosis, and the severe stenosis when it is more than equal 70% of stenosis, which was classified based on the North American symptomatic carotid endarterectomy trial, that is NASCA criteria. Now I am going to reveal our study result. Regarding the age distribution between the diabetic and non-diabetic group, it showed that most of the population were from more than 50 years of old. However, this study was not statistically, this parameters was not statistically significant. P-value was 0.49. Regarding the gender distribution, majority were male, and the study was found statistically significant between these two groups. We also analyzed the risk factor and of the patient. These are the risk factors that we analyzed between these two groups. Among them, the family history of cerebrovascular disease were found significant, that is 0.016. Distribution of the patient in relation with preoperative diagnosis of coronary artery disease types. Here it is showed that TVD was more, that is triple vessel disease were found maximum cases, that is 66.7% in a diabetic group, whereas in 81% in non-diabetic group, although study was not statistically significant. Presence of significant carotid artery stenosis among the population, we found that significant carotid artery stenosis is more than around 42%, and whereas no or non-significant carotid artery stenosis were 58%. Now, the degree of carotid artery stenosis between these two groups show that non-diabetic group are having a normal carotid artery. However, mild carotid artery stenosis is present more or less similar in both these groups. Moderate and severe carotid artery stenosis are more in diabetic group, and it was found statistically significant. So that also it's revealed that the significant carotid artery stenosis is more in diabetic group. P-value was 0.001. So we also compared our study population according to the site of involvement of significant carotid artery stenosis. In this study, we found that right carotid bulb and the right common carotid artery are more vulnerable, and it was found that statistically significant between these two groups. Significant carotid artery stenosis and its laterality. In diabetic group, we found that bilateral carotid artery involvement is more, and it also found statistically significant. We evaluate the patient's preoperative glycated hemoglobin, that is hemoglobin A1C, and significant carotid artery stenosis by Pearson coefficient correlation test for And the test shows that significant positive relationship between the glycated hemoglobin level and significant carotid, that is more than 50, equal 50% stenosis of the carotid artery. P-value was 0.007. Pearson coefficient ratio was 0.270. So after revealing our study result, we can summarize a few points. These are the points. The significant carotid artery stenosis were more in diabetic group. Bilateral involvement also more in diabetic group. Right common carotid artery and carotid bulb were mostly involved site of carotid artery stenosis. Glycemic status having positive relation with carotid artery stenosis. In our study population, most of the patients were more than 50 years of old. Although our study was cross-sectional, but before this presentation, I followed up on those 100 cases, and fortunately, none had any stroke history. These are the few papers which is correlated with our study. This one is the title with carotid disease in diabetic patient undergoing coronary artery bypass grafting, conducted by Shahid and colleagues. The study showed that more than 50% stenosis was more in diabetic group, that is 10.9% in comparison to 5.8% in non-diabetic group, while more than 70% stenosis is also more in diabetic group, 8.3% in comparison to 3.1%. This is another study which is similar to our study also. Severe carotid artery stenosis is found in significant number, that is 10.8% of diabetic patients having triple vessel disease. In this study, they found that diabetes mellitus among the highest recorded risk factors, that was 93.3%. Here another study. The title of that study, the role of carotid artery screening before coronary artery bypass graft surgery. In the study, they found age of 50 years and above, female gender, dyslipidemic patient, diabetic patient are independent risk factor for significant carotid artery stenosis. Another study, the benefit of ultrasound screening of asymptomatic carotid stenosis in diabetic patient with coronary artery disease. It was a retrospective study, case control study conducted on previously asymptomatic patient, those who are more than 50 years old, patient and patient of diabetic and suffering from the coronary artery disease. They found the high atherosclerotic burden on carotid artery among the study population. However, another study, the study showed that carotid atherosclerosis severity in relationship to the glycemic status, a cross-sectional population study. In that study, it was a large study, more than 1,000 subjects were included in that study. And they concluded that glycemic status significantly associated with carotid artery stenosis. Patients with severe asymptomatic carotid artery stenosis do not have a higher risk of stroke and mortality after coronary artery bypass surgery. In this study, there are some other literature I found. Interestingly, this study, other similar study revealed that severe carotid artery stenosis is not alone as a risk factor for the stroke or mortality in patient undergoing CVG. At the end of the presentation, I would like to conclude my study finding with a few comments and recommendations. These are my point. In the current study, diabetic patients were the most vulnerable. To identify the carotid artery stenosis, carotid artery duplex scan was found to be non-invasive and cost-effective. Approximately less than $200 is needed for this scan. It was easy to identify carotid artery stenosis preoperatively, so we could take extra precaution for patients with carotid artery stenosis. Thus, the perioperative morbidity and mortality related to the cardiovascular events can reduce. These are our recommendations. Preoperative carotid artery duplex scan for the patient scheduled for CABG must perform irrespective of the risk factor. The patient with significant carotid artery stenosis need to give extra care to prevent cerebrovascular events. The current study was a single center study on a small study population. So a study should be conducted in multi-center larger population to establish an association between diabetes mellitus and concomitant coronary artery disease and carotid artery stenosis in the local population. Thank you. Thanks for the patient hearing.
Any questions? Thank you so much, doctor. That was a nice presentation.